Let's talk to former Conservative Health Secretary Stephen Dorrell. Good morning, Stephen.
Morning, Kevin.
I'm blaming the doctors here. This is ridiculous. They can't keep demanding 35%. This is planet Earth, not fantasy land. They've got to get real, haven't they? Because I suspect that some of their number, not all of them, but some of them are enjoying this. They want this industrial action to continue because it destabilises a hated Tory government. And we've got to reach some kind of settlement ASAP, haven't we?
Well, I completely agree with the proposition that we have to reach a settlement, but actually saying that the blame belongs exclusively to one side or the other doesn't seem to me to be a helpful starting point, to be honest. I totally agree with you that there is no settlement ever going to happen based on a 35% pay increase overnight. That's certainly true. But it's equally true that no settlement is going to happen if the government refuses to talk about pay. So I think actually blame is pretty equally spread between the two sides.
OK, I mean, I kind of semi-accept that, but I just think any group of workers demanding 35% are deliberately making trouble. They really are, because that's just ludicrous.
I just invite you to think, Kevin, any employer that has a workforce on strike and refuses to talk about pay, what are they doing? Is that performative art as well?
Yeah, I take that point, and perhaps maybe if behind the scenes Steve Barclay could say, look, if you come down to 20%, maybe we could talk, or something like that. I don't suppose he'd actually go that high, but you take my point. Here's another thing I'd like to ask you, Stephen. What I'm sick and tired of is these striking frontline medical workers, including, please pass me the world's smallest violin, those poverty-stricken £134,000 a year consultants who are demanding similar pay rises. It's hard to feel sympathy for people on six-figure salaries, but they say it's not just about money. They keep saying it's about patient safety. We have to get more doctors in, more nurses. I kind of accept that. But don't you tell me that you care about patient safety when your patients are suffering just behind you in the hospital while you stand on a picket line waving placards. Not only is this compromising patient safety, everybody knows people are dying because of these industrial actions, and it's got to stop.
But you could have, if I were the health secretary, I would be handling this differently. But if I were handling it the way Steve Barclay was handling it, you could address virtually all of that to me as health secretary. The truth is that the health secretary is responsible for a health service that is seeing significant numbers of its clinical staff, of its nursing staff, of its medical staff, choosing either to work in other parts of the UK economy but not for the NHS, or choosing to go and work overseas. Now, if the health service is going to meet the demands placed upon it, it has not just to recruit these people, it has then to engage with them and motivate them and secure their commitment to continued participation in the health service. So the real dilemma for the health secretary is that he's responsible for a health service that can't currently attract the staff it needs to treat patients. Now, that's a real issue that the health secretary is responsible for addressing.
Yeah, but OK, yeah, I agree with that. But the doctors, when they say paramount in their minds is patient safety, it's absolutely horrifically disingenuous. Patients behind you in that hospital that you're standing outside waving banners, are suffering because you're on strike. How can you say you really care about patient safety in the long term when you clearly don't give a damn about it in the short term?
And you could ask the health secretary the same question.
You don't like the health secretary, do you?
Look, I've never. No, I do know the health secretary, not terribly well, but he's fine. I don't have a problem with the health secretary. What I have a problem with is that the Rishi Sunak government took office last October. It knew last October that it was going to face winter pressures, it always does in the health service, that it was coming from a long way behind because of the pandemic, but because it was losing ground even before the pandemic, and to choose that moment to engage in a 12-month-long set of pay disputes with the staff who are going to help the health secretary. Well, actually, not help. They're the people who are going to deliver the solution for the health secretary and for the government. It should have been their priority the day they took office, not here we are 10 months later.
I take your point, Stephen. Thank you very much. Good to talk to you. Thank you so much. That's Stephen Dorrell, former Conservative Health Secretary.